Do you remember follow the science? That's like the saying, it's our new motto. It's always trotted out, especially when someone wants you to do something that's actually not following the science. Like, you don't need a mask. Wait, you need a mask, you need 2 masks, maybe 6 feet of masks. Finally, they just scream, follow the science. Whenever you hear, follow the science, you can be pretty sure that you're being asked to park your critical mind and just obey the authorities. So now it appears that the CDC itself is no longer following the science because they seem to be ignoring their own scientists, or maybe following politics, or maybe following Big Pharma, or maybe they're following just CDC Director Rochelle Walensky's feelings of doom. Who knows? I think they're just trying to bolster Biden's narrative. But one thing's clear, the CDC is not listening to their own actual scientists. But the big story here again is Rochelle Walensky going against the recommendation of her own CDC panel of physicians, scientists, and other medical experts. They didn't think the booster was necessary for those folks. So much for following the science, I guess. So what is the CDC's Rochelle Walensky following, if not science? I mean, we can make some guesses, but it does seem like she's following the Biden. Remember, it was Joe Biden that went before the country on August 18th and said this. Watch.
Our medical experts announced a plan for booster shots to every fully vaccinated American, adult American. If you got your second shot on February 15th, you're eligible to get your booster shot on October 15th. If you got your second shot on March 15th, go for your booster starting November 15th, and so on. Just remember, as a simple rule, 8 months after your second shot, get a booster shot. These booster shots are free. We'd be able to get the booster shots at any one of approximately 80,000 vaccination locations nationwide. It will be easy. Just show your vaccination card and you'll get a booster. It will make you safer and for longer. And it will help us end the pandemic faster.
To end it, I mean, it's a virus. Biden said this way back on August 18th. Clearly, the administration was keen on boosters for all, double Pfizer vaxxed Americans, right? That's what they wanted everybody to do just this in August. And it looks like he's keen on mandated vaccination for all Americans. Well, lots has transpired since then. Who was telling the president to recommend boosters, this whole boosters for everybody, double Pfizer vaxxed adults way back on the 18th? Because it seems like the White House was getting ahead of the regulatory agencies. The booster recommendation certainly didn't come from Marian Gruber, the director of the FDA's Office of Vaccines Research, who recently quit. And it didn't come from Phil Krause, the deputy director of the same office, who also quit. We don't know why they quit exactly, but we can make an educated guess. Here's what these 2 former FDA experts wrote in The Lancet. Now, I know The Lancet has its own issues, but this is what they wrote in that journal, and pay close attention to this. Quote, although the benefits of primary COVID-19 vaccination clearly outweigh the risks, there could be risks if boosters are widely introduced too soon or too frequently, especially with vaccines that can have immune-mediated side effects. If unnecessary boosting causes significant adverse reactions, there could be implications for vaccine acceptance that go beyond COVID-19 vaccines. Thus, widespread boosting should be undertaken only if there is clear evidence that it is appropriate. Current evidence does not appear to show a need for boosting in the general population in which efficacy against severe disease remains high, end quote. So that's what 2 prominent FDA officials thought of these boosters. They had questions about them, big time questions. So in fact, it appears those questions caused them to quit when they realized that the administration was going to go forward with recommending the booster to healthcare workers and teachers and grocery store employees and any other worker who's around a lot of people. They apparently didn't agree with this decision. Now, that's a big deal. Apparently, the guidance, reportedly crafted by military attorneys, urged Coast Guard chaplains to grill service members on their religious beliefs and practices, according to draft documents obtained by the Daily Caller. They say, quote, note any comments made by the member that make it appear that they're using the religious exemption as a ruse to end the vaccine, end quote. Ethics and Public Policy Center senior fellow Roger Severino told the DCNet Thursday, quote, this is one of the worst establishment clause violations I've seen in my lifetime, end quote. So let's just say for the record, I think people have lost their minds. We don't care about others' exemptions. We're all up in everybody's business. We're asking chaplains to talk Coast Guard service members out of their religious beliefs. I mean, think about this. And conscientious objections to the vax aside, we are now officially not following the science. And you knew that already. And so did I. But now it's clear the CDC director is overruling her own panel. And we know the FDA has likely had defections over these boosters, but the administration is going forward with them for the majority of the double vaxxed anyway. So soon, whether science indicates it or not, what do you want to bet that you're going to be compelled to get that booster or lose your job? Because we're not following the science anymore. We're following a mass vaccination agenda that includes numerous endless boosters, and that was announced by the Biden administration back on August 18th, before the science had even come in, before those in health agencies could weigh in. And once they weigh in, when they disagree with the administration's narrative, they're overruled, just like people's conscientious objections are overruled. Why?